Michel Foucault's book, The Birth of the Clinic, is a detailed historical and philosophical examination of the changes in medical thought and practice that took place in the late 18th and early 19th centuries. The book looks closely at how the modern clinic emerged and how medical knowledge began to be shaped by the way doctors looked at and spoke about the human body. Foucault focuses on the idea that seeing and knowing became closely linked in medicine. He explores how power, institutions, and discourse changed the way it was thought about health, illness, and the body. He begins the book by discussing the shift from a medicine of speculation to a medicine of observation. In the old way, diseases were described as forces inside the body or as imbalances in the body's natural elements. Doc- Doctors used to rely more on abstract theories than on what they could directly observe. But in the modern clinic, doctors started to focus more on what they could see, touch, and hear in the patient's body. Observation became central. This new focus led to thinking about disease, not just as something that affected the whole body, but as something that could be located in a specific part or organ. One of the main points in the early chapters is that this change was not just about science getting better, it was also about changes in power and institutions. The French Revolution, for example, created new hospitals, changed the role of the state, and made it possible to recognize how doctors were trained. The hospital became not just a place of care, but a place of learning and research. Doctors began to use patients in hospitals to diseases, perform autopsies, and develop new knowledge. The patient was no longer just a person to heal, but also a subject to study. Foucault examines how the clinical gaze developed. This is the way doctors look at the body, separating it from person and analyzing it as an object. This gaze is powerful because it turns the body into something that can be studied, described, and written about. The medical case became a written account, and these records built up a new kind of medical knowledge. This process made doctors into experts, gave them authority over truth about the body. Foucault shows how language and visibility work together. Doctors see symptoms, name them, and then write them down in a structured way. This new medical language was not just about describing, but also about controlling and organizing what could be known. As Foucault moves through the chapters, he shows how these changes in seeing and speaking allowed doctors to create a new map of the body. Anatomy became more important, and autopsies helped link diseases to specific organs and tissues. Illness became something localized and described in precise terms. The development of pathological anatomy was key. Diseases were no longer seen as general disorders but as concrete problems with parts of the body. The doctor's job became to connect symptoms to visible changes inside the body. Another important idea in the book is that medical knowledge is shaped by institutions. Hospitals, medical schools, and governments all played roles in how medicine developed. These institutions determined what could be studied, how patients were treated, and who could become a doctor. Medical truth was not just discovered, it was produced by these systems. Foucault argues that knowledge and power are always connected. The rise of modern medicine was also the rise of new way to manage people, control populations, and define what was normal or abnormal. Foucault also looks at the way the doctor-patient relationship changed. In earlier times, patients were seen as people who could describe their suffering and help guide the diagnosis. But in the modern clinic, the doctor became the one who knows. The patient's voice was less important. What mattered was what the doctor could observe. The patient's experience became secondary of disease. This shift made the doctor more powerful and created a new kind of silence for the patient. The last chapter focused on how this system became more formalized. Medical schools began to teach students to observe, describe, and record in a specific way. The way students were trained reflected the new model of the clinic. Students learned not just to treat illness but to speak in the language of science, use the clinical gaze, and contribute to the growing body of medical knowledge. Teaching hospitals played a big role in spreading this model. Students learned to see patient as a case to study and a source of information. Foucault explores how illness became a way of classifying and organizing people. Certain diseases were linked to certain classes, lifestyles, and environments. Medicine became a tool for social control. Public health measures like sanitation, vaccination, and quarantine were based on the same ideas of observation, classification, and control. Doctors were not just healers, they were also part of a system that governed